Elderly in Ridley Township, Delaware County, Pennsylvania, by Rosemary Lanzalotti. Ridley Township, Pennsylvania. Ridley Township is in Delaware County, PA. It is a suburban area located in the southeastern part of Pennsylvania, which covers approximately 190 square miles and approximately 7 miles south of the Philadelphia airport. Population is 30,768 as of 2010. Of that 30,768, 27,133 are Caucasians, 1,714 are Black or African Americans, 1,165 are Asians, and 1,141 are Hispanics. There are 4,429 occupied housing units. The median household income is $54,895 over the age of 25. There is a 7.6% unemployment rate. 89.5% are high school graduates or have associate's degrees. 29.3% have bachelor's degrees or higher. Less than 1% is not a high school graduate. My subpopulation is the elderly in Ridley Township, PA. The elderly population, which is 65 and older in Ridley Township, is approximately 15.7%. Of that 15.7%, 6.1% are men and 9.5% are women. Of that, 82.1% make up Caucasian, 12.5% make up Black, African American, 3% make up Hispanic, and 2.4% make up the Asian population. The number one leading cause of death in the elderly in Ridley Township is heart disease. There were 1,122 deaths, followed by cancer, which were 927 deaths. Elders who are 65 or older are automatically enrolled in Medicare, which is a federally run health insurance program. Medicaid is both a federally and state-run program that helps pay health care costs for people with a tight income. Chronic health conditions. Biophysical determinants. Approximately 92% of seniors have at least one chronic disease, and 77% have at least two. As the body grows older, the immune system slows down, thus placing seniors at risk for health problems including arthritis, health conditions, and/or cancer. Genetics also affect chronic health conditions. Family history is a strong indicator for common diseases such as cardiovascular disease, cancer, and/or diabetes. Poor physical environment can decrease quality of life. Poor air quality is linked to premature death, cancer, and long-term damage to respiratory and cardiovascular systems. Air pollution sources include dry cleaners, gas stations, auto body paint shops, cars, buses, airplanes, chemical plants, refineries, and waste incinerators. Contamination by chemicals in the water supply can lead to severe illness. Since the elderly are immunosuppressed, people over the age of 65 should get flu shots annually, pneumococcal vaccine every 10 years, and one-time shingles vaccine even if the person has had shingles. Maintaining a healthy physical environment increases the quality of life. Chronic health conditions, behavioral determinants. The quality of life and chronic illnesses amongst elderly varies, which affect their behavior. Chronic conditions affect seniors' mobility and consequently their physical and functional status and emotional balance. Self-esteem decline because of their dependence on others. Because of chronic illness, there is a decrease in quality of life for elders, which is related to unhappiness and psychological distress. Chronic illness can lead to malnutrition, dehydration, and insufficient nutrients. Dehydration leads to muscle function loss, renal failure, and altered state of consciousness, which can lead to depression, thus poor quality of life. Dietary intake may be affected by loss of teeth, which can lead to no desire to eat a nutritious diet. Elderly need to choose healthy meals since food provides nutrients in which most elders lack. We need to remember that most elders do not like a plate when it's filled. They prefer smaller meals 3 times a day. Most importantly, they need to be encouraged to drink fluids to prevent dehydration. Chronic health conditions, sociocultural determinants, living arrangements, and family responsibilities both have significant influence on the health of the older population. When people live in poverty, there are potentials for poor health outcomes due to non-affordability of health insurance. They need to adjust to their physical limitations, which can be a challenge to many. The body slows down, reflexes decline, and eyesight can deteriorate slowly, which can be depressing for seniors. Since Ridley Township is a tight-knit community, neighbors need to be reminded to check in often on their elder neighbors living alone so they can feel more secure. Ridley Township offers Health Awareness Day annually that includes free health screening for seniors, which include cholesterol, glucose, and other free health screenings through the Crozier Keystone Health System. It also gives information on disease prevention, detection and treatment, eating healthy, staying fit, and tobacco cessation. There is a program in Delaware County called COSA, which stands for County Office of Services for the Aging, that provides well-being and to maintain independence and dignity in a home environment. If an elder feels they are not being cared for or protected by their family, they can call this service. Chronic health conditions, health services. The elderly in Ridley Township can experience barriers to health services due to inadequate or no health insurance and lack of availability of services due to unable to drive and are waiting for family members to be available. This leads to delays in experiencing proper care, inability to obtain preventative services, and inability to prevent frequent emergency room visits. Prescription drugs affect the elderly regarding healthcare due to inappropriate use and cost. Inappropriate use can lead to lower effectiveness of some drugs and can increase the risk of adverse drug reactions of others. Families and neighbors need to come together and have a plan regarding taking seniors to doctor appointments. Communication barriers need to be eliminated between provider and patient so both can understand the health-related issue and also prevent med errors. My nursing diagnosis. Risk for altered health maintenance among elderly in the Ridley Township community related to lack of health and nutrition resources and educational classes. Since chronic health conditions affect the elderly, there needs to be amenities to promote healthy eating programs. Developing community exercise programs would benefit to prevent elders from getting worse. If the community offers educational classes to the elderly, such as osteoporosis prevention, cardio training, walking group programs, and healthy eating classes, hopefully there will be less emergency room visits and better quality of life. My nursing intervention plan. To achieve the importance of delaying chronic health conditions in the elderly, I would set up a training program in Ridley Township that will include education on healthy eating and exercise, which would be eating a well-balanced diet to stay energized and maintaining a healthy weight. Education on the importance of eating fruits and vegetables, approximately 2 servings each per day. Education on water intake, approximately 8 8-ounce glasses per day to prevent dehydration. Decreasing sugar intake to prevent or delay diabetes. incorporating approximately 150 hours a week of exercise programs to increase flexibility, strength, and balance, which can include cycling, walking, swimming, water aerobics, Zumba, to name a few, and also dumbbell strength training. My references are below.